This insightful video thoroughly deals with the significant effects of PEMF, or pulsed electromagnetic field therapy, with a very special and important focus on its practical application in equine therapy. In recent years, PEMF technology has developed rapidly, both in human medicine and in veterinary medicine. But what exactly happens in the body with this method? How do electromagnetic pulses influence biological processes at the cellular level? And what of this is scientifically proven? In the next few minutes, we will explore exactly this question. We will look at the biophysical foundations, cellular mechanisms, and clinical practice, with many examples from applications in horses. This video is aimed at veterinarians, therapists, and all professionals who work with horses and are interested in evidence-based integrative approaches. Our goal is a well-founded understanding. How does PEMF work? Which parameters are crucial, and how can they be meaningfully integrated into practice? What exactly is PEMF? PEMF stands for Pulsed Electromagnetic Field Therapy, which is the beneficial use of pulsed electromagnetic fields for a wide range of therapeutic purposes. This does not just involve static magnetic fields, like those found in magnetic badges, but rather rhythmically pulsing magnetic fields. These are constantly changing, usually in the range of 1 to 50 Hz, but up to 100 Hz is also possible. The crucial point is that these impulses penetrate the body, passing through the skin, muscles, and connective tissue, and act at the cellular level. The effectiveness essentially depends on 4 parameters. First, the frequency. How many impulses are sent per second? This is measured in Hertz. Low frequencies between 1 and 50 Hz are especially effective for regeneration, anti-inflammation, and metabolic activation. The second point is the field strength. Field strength is measured in Gauss or Tesla. Most PEMF devices in the veterinary field operate with a field strength between 100, 1000, but also 10,000, 5,000, or 7,000 Gauss. Field strength is related to how deeply it penetrates the body. Third, the pulse shape. Very important, for example, rectangular, sinusoidal, or exponentially decaying. Each shape has a different biological effect, depending on how cells respond to it. Fourth, the pulse duration. How long a single pulse lasts. These 4 variables are crucial in determining how different tissues respond, whether muscle cells, nerve cells, cartilage cells, or immune cells are being targeted. As early as the 1970s, it was clearly shown that PEMF can significantly accelerate bone healing, especially through the groundbreaking work of Bassett in extensive orthopedic research. Break time equals 0.5s/today, we now understand that the beneficial effects are much broader and far-reaching, and that's precisely what makes PEMF so incredibly interesting and valuable for comprehensive, holistic equine therapy. Now, let's move on to the cellular mechanisms of action. Anyone who wants to understand how PEMF works has to look at the smallest unit of life, the cell. Every living cell has an electrical membrane potential. This voltage difference between the inside and outside of the cell membrane controls fundamental processes such as the uptake and release of ions, the transmission of signals, and communication with other cells. This is exactly where PEMF acts. Studies show that certain frequencies can open voltage-gated ion channels, especially those for the sodium-potassium pump, in other words, for calcium, sodium, and potassium. This movement of ions changes the internal environment of the cell and activates so-called second messenger cascades, including PEMF, a central messenger for cellular metabolism. IP3 acts on calcium stores in the endoplasmic reticulum. Calmodulin, an enzyme activator for growth and repair processes. A special focus, of course, is also on the mitochondria, the powerhouses and batteries of the cell. This is where ATP is produced, the universal cellular energy. Studies show here that PEMF stimulates the respiratory chain and can increase ATP production by 20%. Break time equals 0.5s/. This means the cell gets more energy for healing, cell division, and immune metabolism. In addition, PEMF also influences gene activity, for example via transcription factors, anti-inflammatory, cell-activating, and HIF-1 alpha, for instance, is active during oxygen deficiency. These molecular effects have been proven to be responsible for a variety of positive effects of PEMF, such as pain relief, wound healing, inflammation regulation, and tissue repair. In summary, this means that PEMF does not just work on the surface. It communicates directly with the cell and actively activates the body's own inherent self-healing powers from deep within in a biophysical and profound way. Now we would like to focus on an exciting mechanism of action: the reduction of oxidative stress, a key factor in many chronic diseases. How are PEMF and oxidative stress connected? A frequently underestimated but crucial mechanism of action of PEMF is the reduction of oxidative stress. What exactly does that mean? Oxidative stress occurs when the balance between free radicals, also known as reactive oxygen species, ROS, and the body's oxidative defense systems is disrupted. These free radicals are produced naturally in cellular metabolism every day. But during inflammation, trauma, intense physical exertion, or even due to environmental factors, their levels increase dramatically. And that's exactly where the problem lies. Free radicals attack cell membranes, proteins, and even DNA. They disrupt cellular metabolism and delay healing processes. Especially in equestrian sports such as eventing, show jumping, dressage, endurance riding, and so on, micro-injuries to muscles, connective tissue, and even tendons occur regularly. These trigger local inflammatory reactions, which in turn are accompanied by oxidative stress. And this is exactly where pulsed electromagnetic field, PEMF, therapy truly comes into play. Extensive studies have consistently shown that the strategic use of low-frequency PEMF fields can significantly increase the beneficial activity of crucial antioxidant enzymes, most notably superoxide dismutase and glutathione peroxidase, that is, more commonly known as SOD and GPX. These vital enzymes are instrumental in helping to effectively neutralize harmful free radicals and thereby prevent significant cellular damage. At the same time, PEMF reduces what's known as lipid peroxidation, that is, oxidative damage to cell membranes. This leads to stable cells and healthier tissue. And the result when using PEMF, the affected tissue today, well, we have to. And the result of using PEMF is that the affected tissue returns to homeostasis more quickly, that is, to a state of internal balance and healing. And there is compelling evidence that PEMF also actively promotes the significant release of nitric oxide, NO, a vital natural signaling molecule within the body with powerful vasodilating, anti-inflammatory, and circulation-boosting effects. These processes are especially important in chronic conditions such as osteoarthritis, tendinitis, or laminitis. Here, the body's inherent ability to effectively regulate oxidative stress is a truly key factor in the process of healing. Now, we want to take a much closer and more detailed look at the important topic of tissue and carefully examine how PEMF effectively affects muscles, tendons, joints, hooves, and also the surrounding fascia. The specific tissue-related effects of the PEMF treatment. After thoroughly discussing the intricate cellular mechanisms of action, let's now carefully look at precisely how PEMF profoundly affects the various different tissues within the horse's entire body. Because, depending on the specific type of tissue, the human body reacts quite differently, and therefore the application of treatment must also be carefully adjusted to the particular tissue type. Let's now take a look at the different tissue types and PEMF. Musculature. PEMF has a measurable effect on microcirculation, that is, on the blood flow in the smallest vessels of the musculature. This means for us that significantly more oxygen and essential nutrients are able to reach the affected tissue more effectively. Waste products like lactates are removed more quickly. Especially with existing tension in the back muscles, for example due to an ill-fitting saddle, prolonged one-sided strain, or even stress, PEMF can effectively help to relieve this tension and promote the horse's overall relaxation. Break time equals 0.5s/. In addition, PEMF profoundly influences the calcium ion channels within muscle cells, which consequently has a very positive effect on their overall contraction ability and muscle tone. For tendons and ligaments. This is a very important point. Tendons and ligaments are mainly made up of collagen fibers, which are arranged in parallel strands. After injuries, unstructured scar tissue often forms. This particular tissue is considerably less elastic and, as a result, more prone to further significant damage. PEMF, or pulsed electromagnetic field therapy, can effectively promote the formation of more organized collagen here, and numerous studies definitely show that the healing process is more functional, with significantly greater resilience and improved elasticity. Especially in cases of significant suspensory ligament injuries, severe flexor tendon lesions, or substantial ligament strains, PEMF can be a truly valuable and beneficial addition to the overall therapeutic approach. The use of PEMF specifically for joints. Joint cartilage is not supplied with blood. The nourishment of chondrocytes occurs through diffusion from the joint fluid. PEMF activates these cartilage cells. They start producing proteolycans and type II collagen again. At the same time, the release of inflammatory cytokines is reduced. For us, this means less inflammation, more regeneration, and therefore better joint function. This is especially relevant for conditions like spavin, osteoarthritis, or other diseases. Laminitis and PEMF. This is a very, very sensitive area. In laminitis, blood flow in the area of the hoof corium is severely restricted. PEMF can, through the NO cascade, that is, the nitric oxide cascade, cause vasodilation, meaning a widening of the blood vessels. This leads to better oxygen supply, less pressure in the tissue, and ultimately pain relief. In addition, PMS can also significantly improve lymphatic drainage, which is very helpful for alleviating both edema and general swelling. Topic: fascia. The role of fascia is increasingly recognized in equine therapy. They not only affect mobility, but also the nervous system. Fascia is the third largest neural network in the body after the brain and the gut. PEMF can effectively help to release myofascial adhesions, significantly improve the gliding ability of the fascial layers, and gently harmonize the body's autonomic nervous system. Especially in anxious, jumpy, or hypersensitive horses, a calming effect is often observed, visible through chewing, yawning, and deep breathing during the treatment. So now, a lot of theory. Let's take a look at how this works in practice, or rather, some practical tips, okay? I'd now like to present the areas of application for PEMF in horses using concrete case examples from practice, okay? Example: PSSM horses. This genetically caused muscle disease occurs mainly in quarter horses, Haflingers, Noricas, but of course also in other horses. The muscle cells store excessively abnormal glycogen compounds, which leads to stiffness, muscle tension, and a drop in performance. PMF therapy significantly helps here by substantially increasing ATP production within the muscle cells, thereby actively stimulating and enhancing overall muscle metabolism. Furthermore, it remarkably improves vital blood circulation throughout the body through the efficient generation of nitric oxide, commonly known as NO. In combination with exercise and an adapted diet and feeding, rideability can be significantly improved. For example, kissing spines. Touching spinous processes in the back area often lead to significant back pain, problems with rideability, and muscle hardening along the entire spine. PEMF works here on two levels: relaxation of the paravertebral muscles, anti-inflammatory effects in the affected vertebral segment. In practice, it is often observed that after 3 to 5 treatments over a period of 2 to 3 weeks, mobility improves and pain behavior decreases significantly. For example, laminitis, an acute, extremely painful inflammation of the hoof corium. But even in chronic cases, therapy remains a major challenge. PEMF supports here by promoting blood circulation in the hoof capsule area, reducing edema, and relieving pain by activating the body's own regulatory mechanisms. Studies on nitric oxide clearly indicate vasodilation and strongly suggest that PEMF positively influences the capillary pressure in the specific area of the coffin bone. For example, tendon lesions. Acute or chronic tendon injuries are a major issue, especially in sport horses. PEMF works on several levels here. It structures collagen fibers, reduces inflammatory processes in the peritendinium, and promotes cell migration, for example, of fibroblasts. In vitro, this example was done with horses, and in vitro, tenocytes were also detected here. The Wang study from 2018 can be found online. For example, bone spavin in the hock joint. With this degenerative joint disease, PEMF reduces synovial inflammation, cartilage degradation, and improves the range of motion. It's important that the application should be carried out regularly over 4 to 6 weeks in order to achieve a lasting effect. Additional indications, typical scar treatments, surgical scars or injuries, internal or external, edema and lymphatic congestion, regeneration after competitions, long transports or birth, stress reduction for nervous horses. All these examples show that PEMF can be used in a very versatile way, always tailored to the specific diagnosis and constitution of the horse. Always consult a veterinarian. In the final chapter, we will look at how PEMF can be applied in practice with tips on protocols, intensity, and safety. How can PEMF actually be used safely, effectively, and in a targeted way in everyday practice? It's important to choose the correct treatment parameters. Here are the most important guidelines for applications in horses. Frequency ranges 1 to 25, 30 Hz, and up to 50 Hz. Ideal for muscle relaxation, pain regulation, and optimal cellular metabolism. Intensity, medium to high intensity for deep tissue, for example in the croup or shoulder. Low intensity for sensitive areas, such as the head, abdomen, eyes, as always. Treatment duration, 10 to 20 minutes, can also go up to 30 minutes per session, depending on the indication. Application frequency in the acute phase, 2, 3, 4, or 5 times per week. For chronic cases and maintenance, once or twice per week. Important, PEMF is not a soloist, but part of the whole orchestra. For lasting success, PEMF should be integrated into a holistic therapeutic approach. Physiotherapy, osteopathy, targeted movement therapy, nutrition in cases of metabolic issues, for example, dental checkups, saddle fitting, and much more. Only when the entire system is in harmony can PEMF fully unfold its effects. Important contraindications should, of course, be taken into account. Even though PEMF is absolutely safe and non-invasive, there are some situations where caution is advised. Acute open fractures, bleeding wounds do not use. Metal implants in the high-frequency range should be discussed with the veterinarian. Pregnancy only after consulting a professional. Pacemakers must not be used, nor should anyone with a pacemaker be present. Conclusion. In summary, as a recap, PEMF is a biologically based, deeply effective, and low side effect therapy with a broad range of applications in modern equine medicine. It supports the body's own processes at the cellular level, in metabolism, in the pain system, and during regeneration. PEMF does not replace conventional therapy, but it combines biophysics with practical knowledge. When used correctly, PEMF becomes a powerful tool for anyone who wants to support horses holistically and responsibly. Thank you for your attention, and I wish you much success in applying it in your daily work with Magnavive PEMF.